We're going to review the cardiac area on the child. We're going to look at rate, rhythm, murmurs, and we're going to check for bruits. You're going to auscultate over the right base, the left base, Erb's point, tricuspid, the apex, and right over the xiphoid. You're also going to palpate for any pulses or thrills that you may feel during this exam. Another part of it is checking for peripheral pulses. So we're going to check radial, brachial, you can check femoral, popliteal, and on the tops of the foot, the pedal pulses. Next we go to the GIGU exam. You're going to have to lay down. First of all, you're going to inspect, auscultate, and palpate. So you're going to inspect the area, see if there's any scars, any wounds, previous surgeries. You're going to look for distension. When you palpate, you can palpate on the right lower and check for rebound tenderness at McBurney's point. You can also check for any masses you may feel, the liver on the right, the spleen on the left. Kern's sign is if you press down and you get rebound pain to the shoulder area, on the left shoulder, and then at this point you can also check for femoral pulses. And then go ahead and sit up. We'll check for neuromuscular area. We're going to look on a child. We're going to inspect, palpate, and percuss. I'll have you stand up. We're going to check posture, and you can do this when they enter the exam room also. You're going to check for any kyphosis, which is a bending over, lordosis, and in kids it's important to look for scoliosis. So I'll have you bend over. You're going to look at the spine, make sure it's straight. If they have scoliosis, you'll see a curvature. Also, you can see one shoulder may be raised more than the other, or an off balance in the hips. Okay, sit up. You're going to check for range of motion in all limbs. And you can check in wrists, range of motion in legs, ankles. You can also have them do a duck walk for kids and adolescents, and it looks for symmetry and balance. You're going to look for symmetry of the muscles on both sides of the body. You're also going to check strength. So I'll put your hands out and push in and up and down, and also on the legs, push out against me and in, and this one, out and in, and push in and out. And neck and shoulders is cranial nerve number 2. When you're looking at this, you can push your hand here and have them push against you, and the other way, the other, tilt your head, and the other. Good. For the neuro exam, you can do this throughout the test. Usually when they come into the exam room, you introduce yourself. You can ask them who the president is, what year it is, what time it is. This checks their mental status. Cranial nerves during the neuro exam are done throughout the whole entire thing. You can check for motor, sensory, gait, deep tendon reflexes. You can also check at the elbows, the knees, and the top of the foot. For skin, you can also do this throughout the exam. You're going to check for color, texture, any rashes, any lesions that may appear. If there's any bruising, the condition of the hair and nails, make sure they're shiny, not brittle. The nails, that there's no clubbing or discoloration. And you can look for capillary refill. This concludes our child exam.